afternoon, everyone, and thank you all for coming back after lunch. I was telling the panelists, I'm scared, it's Friday afternoon. So thank you all for being here. As Melinda mentioned, we've spent the day talking about broadening access, and because we understand that there's a number of barriers to accessing information, like transportation or technology or cost or culture or language or trust. We've talked about these things. We've talked about the need to do something. So this panel is going to focus on what can we do? So we know we need to do something, but what can we do? And it will highlight some specific examples of what our panelists are doing to broaden access to information and really create solutions, co-create solutions with communities and with other organizations. So with that, I am going to let each one of the panelists introduce themselves. They're going to tell you a little bit about themselves and why they care, why this is an important issue to them.
Hi everyone, I'm Allister Chang, and I'm the Executive Director of a 501c3 called Libraries Without Borders. We work in about 20 countries now to support and create libraries. I got into this work in 2010 in Haiti, where we were rebuilding the university library after the earthquake. And it started as a cultural preservation project and ended up becoming a center for the community for disaster relief. And so since then, we've been moving this organization towards supporting disaster relief and filling that gap that we often see in international development between disaster relief and economic development. And, where one organization leaves before another organization comes in. For this particular project that we have outside the Ideas Box, that came about last year, and the reason that I really think that it's important to start thinking through how we build these resources and programs is, from my work, I've seen two things. One, that a lot of my peers are trying to create technologies that are a fix-all for everything, whether it's an app or some kind of website. And we partner with these organizations to try and make them more accessible. So if you look at Khan Academy, for example, less than 5% retention rate, and everyone who uses them, more or less, is trying to study for a university exam that they missed a lecture on. That's not necessarily solving the purpose that it was meant to, there to create. We're trying to make those resources more accessible. And so the theme that I'm really picking up on here, and this is, I think, what I share with most of you and why I'm driven to this kind of work, is the relationships. And for us, when we're building any of our programs, the focal point is on building the capacity of the local community and actually building facilitated programs around the new technologies and around the new innovation.
My name is Denise Britigan, and I'm with the College of Public Health at University of Nebraska Medical Center. Sorry. And a couple things to dovetail into the earlier speakers. A, I embrace aging. B, today's my birthday. And Melinda, thank you very much for an awesome birthday present today. This is really, really cool. And it would be really nice if I could give you each my card before you leave today. That would be my birthday present from all of you. Is if I could exchange cards with you and network and see if you're interested in taking one of these two-sided postcards to explain that one of the things that I've done here in Nebraska is create a massive open access online course for health literacy and communication for health professionals. And it's global and it's free. And we launched it last year and we had over 10,000 learners in 178 countries. Now, if you had asked me a year before that I would have had that reach to share my passion, I would have said no way, but it really did happen, and we're doing it again this year. And in the audience today, and I promised I wouldn't embarrass her, but one of the community TAs, teaching assistants that we have as a volunteer is Anna. Would you stand up? She's here and she's helping moderate some of those discussion forums, because the beauty of having this massive open access online course, which is the Kaneko-UNO, is the fact that people from all over that you have administrators, physicians, nurses, patients, librarians, and allied health professionals all able to sit and exchange the ideas that they have. And so it's really cool. I don't get a lot of sleep because I know that any time, day or night, when I wake up, I can log on to my course and someone will have just posted. Because we cover the globe and all the time zones. Thank you for this opportunity today.
Good afternoon, I'm Ellen Dyson, and I also come from the downstreet University of Nebraska Medical Center called Public Health, and I am the coordinator and outreach specialist for one of the centers in the College of Public Health, and that's the Central State Center for Agricultural Safety and Health. And what we've been charged with by the National Institutes of Occupational Safety and Health is to reduce the fatality and injury rate in our agricultural community. There's 10 of these centers across the U.S. We are very, very fortunate to have one right here in Nebraska. A lot of farmers. My reach is 7 states. I am responsible all the way from, well, I've been up to Minot, North Dakota, a few times, all the way down to Louisville, Missouri, 7 states in that corridor. So I'm going to discuss with you a little bit today about how we communicate with this group, and I think it will resonate with a lot of you. And I'm sure we're still talking about groups that are isolated. We are talking about aging populations. The average age of farmers is 58 years old today. We're talking about a group that may not trust technology. We did a very large survey of over 580 face-to-face interviews with the farming community. They do not want tweets, apparently. So quit tweeting us. They're not going to get our tweets. They aren't tuned into that. And that's not just for 58-year-old farmers. So we would like to think that we can use these novel new technologies, and actually we did. We thought about, we have a database of about 27,000 farmers. A lot of those we made relationships with, and they go open my emails now. A lot of them, they immediately go into the trash, immediately. We're working steadily for those that are accepting technologies, but we do have a huge issue with isolation. We have only about 70% of our farmers that have reliable internet, so we do want to get information out to this group that way. So we want to a little bit discuss some of the ways that we are trying to reach these groups, and I would love to discuss with each and every one of you ways that we can reach out and do a better job with the job that we're doing.
That is super fascinating. So I was just talking about that. We were talking about that about 5 minutes ago. I'm from a small farm in South Dakota, so I'm really fascinated. Anyway, my name is Rebecca Stavick. I'm the executive director of DoSpace. DoSpace is a community technology library and innovation space for the public, and we are opening November 7th. So we're going to have a big grand opening celebration. I hope each and every one of you can join. We are located at 72nd and Dodge at that old Borders that had been sitting sadly vacant for probably about 5 years. You've probably seen some of the construction there at the corner, and so we're very, very busy the next few months to make sure that it's open and ready for you guys. So DoSpace, at the core of that project, it's about access and education to technology. So if you haven't heard of a community technology library, you're not the only one. I don't believe it actually exists. I was just talking as well about how DoSpace is kind of hard to describe because there's nothing quite like it in the country. And I think it kind of defies categories altogether. So I feel like we shouldn't probably put it in one. It'll just sort of define itself over time. So I'm talking about tech access and education. So like a public library, DoSpace serves everyone in the community. So that's everyone from, I need to get on Facebook, I need to check my email, or I've never used a computer before, I need to learn how to use a mouse. So we appeal to those folks. We also appeal to advanced computer programmers who are maybe upping their skills, they're learning a third or fourth computer language, and or they need special expensive software. So we will have some pretty advanced design software, very advanced 3D lab that we'll be using. But there's also a big educational component to it, because access is one thing, right? but knowing what to do with technology is a totally different thing. So we'll have an entire department that's going to be crafting some really interesting tech, STEM-based, innovative learning opportunities for the public, and it's all free. Membership is free. We got to pay for printing. Sorry. That's about it. My background is in public libraries. I'm a former employee of Omaha Public Library. My master's degree is in information science. And I also co-founded a civic hacking organization called Open Nebraska. It's code for American Brigade. And we're still going strong here in town.
My name is Joyce Neujahr. I'm Director of Patron Services at Criss Library at the University of Nebraska, Omaha. And I have a suspicion the reason I'm sitting here is because I'm Melinda's boss. And what a hard job. You can see. And you did a great job, so there may be a raise or Thank you for inviting us all, Melinda, and you arranged this and you did most of the work all by yourself, so you deserve a lot. University of Nebraska Omaha is deeply committed to this community and spends a lot of time talking about community engagement. We built the new Community Engagement Center building, specifically dedicated to working with others in this community. And Criss Library is also a part of that and supports that. So I think what I'd like to say for a message for everyone to hear would be, don't forget about UNO as a resource for you. We do what we can to get out. We talk about could making you come to us. We need to get out there. And we do try to do that. Could we do better? Do better. But don't forget about contacting us. And if you don't want to call someone on our campus, call the library. And we'd be glad to make the connection. We've heard that over and over again too. Librarians like to make connections. We'd love to get you connected to information, to resources, whatever it is that you're looking for. We truly are a service-oriented profession, and that's part of why I entered it. I have a very deep and profound sense of this is not about me. And I think that's what we've heard over and over again. We've heard it from Alice. Another sense that we are here to help and to serve others and ourselves. So I think that will continue, and while we have that, we'll continue to build on that.
Okay, so thank you all for introducing yourselves. I think I'm going to start back with Ellen, since you're right in the middle. Ellen, you mentioned that you do a lot of work with outreach to agricultural and rural communities across our state. And I think, Nebraska is known for the agricultural industry that we're home to. So can you share some examples of what CHES-CASH is doing to really promote information access and the resources that you have? Can you share with us some innovative ideas?
Right, innovative.
Yes.
Here's what I want to tell you. A lot of our work is old school. And we've gone back to what we thought we were going to be innovators. We thought that using electronic media was going to be the answer to reach our populations. And to some degree, I think we have had some success. But what I want to tell you is we've gone back to old school, boots on the ground. I have traveled in this year, in the past 12 months, I've been in 50 locations throughout Nebraska. That doesn't include our other 7 states. I'm very tired. I just finally cleared my sinuses from Husker harvest days. We had 95 degrees with 40-mile-an-hour winds for 3 days, and we were in the hospitality tent, which was not very hospitable. I did not this year because I wasn't doing any tallying. I can tell you I gave out over 3,000 earplugs and about 800 respirators, and I don't get anything out without someone knowing how to use them before they leave our booth. So that's a big, I have no voice at the end. So we have found that with this demographic, we do go to them, but they have to come a little bit to us. Because when you think about some of these farms are 30 or 40 miles apart. hard. When you get out into western Nebraska, it's kind of hard to find folk out there. So we can't visit every individual farm. We do collaborate that. Now I'm moving into what we think is a little innovative because we're trying to find some great collaborators to get our information out to and also to host us. I know you talked a lot about trust. People, us coming in from the University of Nebraska, Omaha is 1,000 miles away from Scottsbluff. Okay, so if you've ever driven it, you think that. And so these folks, when I go out there and they see the UNMC or they see the College of Public Health and they see the CHES-UNMC, it means nothing to them. It basically means nothing. We want to change that, but right now it means nothing. And so what we have to do is we have to build trust. So I am working very hard to work with the extension agents, very trusted bunch of folks. If you're ever working in agricultural communities, get with your extension agents. Public health departments, love them. They trust a lot of public health departments. So if you're disseminating a lot of our information, we have, oh, and I didn't talk one bit about bird, let me tell you a little bit about bird. Agriculture, forestry, and fishing, highest rate of fatalities in the nation. And I surprise some of you, highest rate of fatalities. So more of our farmers, fishermen, and foresters are dying every year than any other occupation. No one should die because of what they do for a job, period. So what we need to do is get information out to them about how to prevent that. Some of the ways that they die are incredibly horrible ways too. If you go on our website, you'll see some examples of how people die. Sorry about that, but we do keep a database, and it's important because storytelling is important to us as well, and that's one more innovative way that we're doing that, working with some of these survivors or the families of these folks that have had injuries to tell their stories. Because people listen. When they know it's them, they listen. We also did massive surveys to understand what these people want. 78% said, keep it simple, stupid. Keep it simple, stupid. Don't send me something that talks about how my lungs function. They don't care. They want to know how to put that mask on, and they want to know how to take it off and take care of it, period. So we learned a lesson about that. We've only been in business for 4 years, so we're still babies. I feel like we're still babies. We use collaborators within the College of Public Health and health literacy. You need information, go to this girl. Because we were trying to put out some information that was using some terminology that probably 80% of our people may not have understood. She set us straight on that. We changed all our flyers and all our brochures. Flyers and brochures, old school, right? That's what they want. They want short, they want simple, they want pictures that relate to them. We found that out. Don't send a North Dakota farmer a picture of a grain bin. They don't grow corn up there. They grow safflower and sunflower, and they don't store it. So we don't even need to discuss with the North Dakota farmers that type of issue. But we do. You know what they want to talk about? They want to talk about how to stay safe on the roads with all the fracking trucks. They're killing their kids. The fracking trucks are killing their kids. They don't care about themselves, they care about their kids. So first thing when we got up there and heard that, we made a flyer about how to be a responsible, and we sent it out to the fracking companies, how to be responsible on country roads. Because these people know, they grew up there. These truckers up there have never driven with farm equipment, ever. Boot Hill in Nebraska, don't talk to them about corn or soybeans. You know what they want to talk about? How to protect their critters safely. You had a gal who told me her biggest concern is when she goes out shooting coyotes, that she's going to shoot her neighbor. I said, well, I didn't even think about that. So know your audience, I guess, is a lesson that we've learned. And so for us, collaboration, old school, boots on the ground. We still do some innovative. We have 27,000 farmers in our database that are still going to give the information whether they need it or not, or wanted that, doing that method simply because I have it, and it's a cheap way for me to get out there. And getting to where they go. Being really creative. We did surveys at Casey's. Anyone ever been to a Casey's on a Monday morning at 6 o'clock? You got all the farmers there, right? Buying donuts, and they'll take your survey.
Farmers Business Network.
Farmers Business Network.
There's something that they're trying to do social media wise to streamline farming. So if it's at Nebraska,
because we do, even though they told us not to tweet them, we tweet them. But really, we're just tweeting each other. I'm tweeting Athena.
And I retweet everybody, so.
And we use Facebook and some of those, so I would be very interested because this is National Farm Safety and Health Week, by the way. We need to may not know that. So we have done a massive amount of tweeting and posting.
Well, thank you, Ellen, for sharing some of what you're doing with CS-CASH. So it sounds like we kind of take a turn away from technology, but really trying to focus on what is going to be meaningful for the audience, what's going to be relevant, and what's going to be responsive to their needs. Like, I think that sometimes in trying to do good, we don't focus on the end user. We focus on ourselves, that we want to help instead of being helpful to the person that we're actually trying to help. So thank you for sharing some of what CS-CASH is doing. I'd like to go now to Rebecca, because I think this idea of being local and being responsive to community needs is something that resonates with what DoSpace is doing. So can you share a little bit more about DoSpace and why technology access is important for the Omaha community?
For sure. I kind of wanted to say just briefly, you were talking about how you kind of boots on the ground, not innovative, all that. I gotta say, like, if it works, that's what's innovative. I'm a huge tech advocate, but I can't stand tech for tech's sake. You know, if Twitter's not working, why would you still use, Twitter like over and over? And so I think people feel a lot of pressure to be super, super high tech, and if that's the right solution, then great. Let's do it. But if it's not, then you need to look at really what works, because the end goal is to help people, right? So I feel you on that. So DoSpace, kind of like I said, it's all about access to technology and then unique learning opportunities for the public, and we serve all ages. In terms of access, there is a pretty pronounced digital divide in Omaha. It's actually right up and down 72nd. Which is kind of interesting because DoSpace is right there on 72nd. And the location that we chose for this project was totally strategic. I mean, if you could pick one place in the city that would reach the most people from all over the city, that is the intersection. It's really easy to get to that spot through the bus system. That was very important to this project. That particular location is just as appealing to anyone in North Omaha, South Omaha, West Omaha. It's just easy to get to. Even from the interstate, if you're coming from out of town, you can get to it. So that was really important to us. So there's a digital divide issue, and as I said, most cities struggle with this, access to technology. If you don't have access, you can't get connected, you can't communicate, you can't access all of the amazing things online. But we're seeing now that access alone is not the biggest issue, right? So the digital divide was a huge issue 10, 15 years ago, right? But now more and more people are connected, but they're connected in a different way, and it's through your phone, right? And what's kind of troublesome with that is that folks who really don't have a lot of income, they're struggling financially, they might have a smartphone and they might be able to connect it to Wi-Fi. It might not actually be hooked up to a cell service. But think about what your experience is like on a mobile device versus on a workstation, like a computer. On a phone, you don't really have that opportunity to interact with more advanced software. I would hate to try to learn Excel on my phone. I think you can get Excel on your phone. I would never want to. It's a nightmare. There's just not that opportunity to learn more about how to just use software. And the mobile experience on the phone is different. There's mobile sites, and it's made simplistic on purpose. So if your only access, I've heard of kids doing their homework on their phones because they can't get access to a computer. And there's this idea like, oh, the kids these days, they got all these computers in school, and that's not true. Some kids have access to computers in school, and some don't. So that's a problem. So there's the access issue, but as I was saying, access is increasingly less of an issue. Digital skills is really the issue. So people have more and more access these days, but they don't have that they need to succeed in their jobs, get that promotion they need to succeed in school, and all of those things. So the mission of DoSpace is really to empower the community with tech and innovative learning opportunities. And so we're trying to tackle both of those issues at the same time. The digital divide and to boost digital skills. And the way that this is particularly unique at DoSpace is that we will have more advanced software that's really expensive stuff. Like we'll have AutoCAD, we'll have Google SketchUp, we'll have the full Adobe suite, so you don't have to pay for Photoshop anymore, just come to DoSpace. I mean, you know, if you think about that, if you're interested in design work and you're not a student, you don't get it at work, you're gonna have to shell out a few $100 to get Photoshop. So well, you know, that's a huge barrier, especially if you just don't have the money. So we're knocking down those barriers in DoSpace. Come on in and use that software. In addition to all of that, I mentioned we're going to have a 3D lab. I don't know of any space in the country that's going to have a 3D printer like we will have at DoSpace. We have a big dimension printer, and the guy installing it said it was the best one in Omaha, so I'm going to trust him on that. But what's interesting about 3D printing, 3D technologies are incredibly disruptive right now, and the beauty of 3D printing is that you do not have to be interested in technology, you don't have to care at all about 3D printing, because 3D printing intersects with absolutely everything in the world. So if you're a senior citizen and you really dig home improvement, and you have something at home that's broken, chances are you can come into DoSpace, design it, find a design online, something like that, and then print it out right there. So in addition to that, we'll have 3D printers that they print in support material, so you can print designs within designs, so they're increasingly advanced. So you could have someone come in and say, I'm just going to download this cute little toy and print it. Okay, cool. You don't need 3D modeling skills for any of that. But we might have an architect come in and say, I want SolidWorks software, I want access to the best 3D printer in town, and we're going to have that so that people can boost their skills. From my work in the tech community here in Omaha, that's a big deal, right? Like we want to make sure that our web developers have opportunities to boost their skills. We need technologists in this town and really across the country who are, there's the beginner, junior level, but how do those folks get to the next step? And be able to learn as a community outside of the tech community. That's important to me, is trying to kind of bring together the techie folks and everyone else. I don't want a barrier there. I want people to be able to be talking to each other. I hope to see that in DoSpace.
Thank you. So we're moving now from a Nebraska and Omaha focus to a more global focus. So I'd like to thank Allister, first of all, for coming all the way to Nebraska to share the day with us. If you've seen the boxes, everyone's seen the boxes, show of hands. Have you all got to talk to Allister about the boxes? Show of hands. Okay, so only a few of you, which is why Allister is going to share with us a little bit more about what is the Ideas Box and what it can do with and for communities all across the globe, and share about some of the great partnerships and collaborations that Libraries Without Borders has been able to create across the world.
Thank you so much. It's a real honor to be here. I'll start by just asking how long you guys think refugees on average live in a refugee camp? You want to take a guess? Months?
3 years.
It's 17 years. And when we learned that information, and this is pretty public information that is just, no one's taking the time to look at any of these World Bank reports. When we learned this information, we thought, that's ridiculous. We, as a community, international development community, yes, it's important to provide food, shelter, water, but if you have an entire generation that doesn't have access to education, that's a loss for the whole world. And I think it's really violating what we think of as the basic role of international development. And so we tried to think through what the best way was to provide educational and informational and connectivity resources to the refugee camps. So the Ideas Box that you see here was our first iteration of that design, and we built it with the UNHCR innovation team in Geneva. And yeah, so the UNHCR is the UN Refugees Agency. And it's been a year now since we've launched the first projects in Burundi, and we've now run programs in Jordan for Syrian refugees as well. For the first time since World War II, we've had more than 50 million refugees in the world, and a lot of them are coming from the Middle East. And as many of you have seen on the news, there's a huge influx going to Europe, and I'll get to that as well. As we've been presenting this project at different conferences like this one, we've built partnerships to use the Ideas Box and redesign the Ideas Box for other contexts. So at a conference at Oxford, we met some folks who wanted to bring this to New York. And this past summer, actually just a few weeks ago, we ended our first program in the South Bronx, which is the nation's poorest congressional district, which is crazy to me because you're a 20-minute drive from a Tiffany store. But what we did there was we used this box actually, and we did pop-up programs on street corners, outside of laundromats, public parks, basketball courts, and we worked in partnership with a variety of local organizations, and this is the point that I was trying to make at the beginning, which is, building this project, we were trying to learn from the mistakes, really, of a lot of the other programs that have tried to bring tech resources and even just basic education resources to communities. The World Bank report, again, that nobody reads. There have been randomized control trials that say that textbooks have made zero statistically significant impact on education in developing countries. They've shown that access to tablets and computers has made zero impact on educational development in developing countries. Of course, we can push back on that and say, there's something with what they're measuring that's at stake. But I think there's something to learn from that. And this goes back to what you were saying about coming back to the innovations are really basic fundamentals. And the problem with a program like One Laptop a Child, right, which was trying to just send computers to all kinds of places, I think the problem with that is that there was no facilitation. There was no curated content. And when kids were using this, there are documentaries written about this, and all the research said that it made no impact on education. People used it to look up the best gossip from the city that they didn't have access to, and that serves its role in certain ways, but it's not really curating any of the, not really addressing the problems that we're trying to solve. So with this project, what we were trying to do is build off of our experiences, like I said, building facilitation around the innovations that already exist. And our organization translated Khan Academy and Code Academy, two of our main partners, into French and Arabic. And not just translating them with subtitles, but finding French professors and Arabic professors that speak Arabic to re-record those videos for the contexts that the audiences that they were directed towards. But that wasn't enough. I think the only way that we've been able to measure real success with those programs has been to run facilitated workshops with those programs in those contexts. So in Cameroon right now, we have French Khan Academy and French Code Academy programs at a local library where you can sign up and actually do a class together using those resources. To me, I think that those technologies really represent a way of supporting the traditional work and extending the reach and audience of the traditional work, but I don't think that it can replace the traditional work. So for us, local partnerships are absolutely essential. In New York, all of the books were curated by the local school principals and the local branch of the New York Public Library. All the programs were facilitated by local arts education organizations that have worked in those contexts. What we were able to add really was, as a small organization, the flexibility of being able to bring those partnerships together. And I think that, when we tour the Ideas Box around, people think that we're selling a toolkit. And that is the opposite of what we're trying to do. I think it is trying to create a space where in the background you have 35 people at our organization working with you, build the program, build the partnerships, and that is what I think the main value add is. If we weren't able to build private, public, nonprofit partnerships, those tools, I think, would be completely useless. And there's nothing that replaces the face-to-face interactions as well as the facilitation. So that's a little bit about the Ideas Box. We are currently building new programs now, and they've just launched. Queensland Library in Australia has just launched Ideas Box programs in the Torres Straits for Indigenous communities. And so I was very excited to talk with the professor earlier today about Native communities here. We've also built programs now in Ethiopia, as well as many different cities in France where there are influxes of refugees coming in. And what those look like are very similar to the project that we just built in Ramos, having pop-up libraries along the Seine in Paris. And why I'm here, and what I'm really interested about learning from you guys, is if and how not only this toolkit can be improved and redesigned for all of our programs abroad. I think a lot of the new ideas that we've generated to make it really mission-focused and effective have come from these kind of conferences, but also to get a better sense of what the local needs are and how a portable system like this can be useful to you. And I think that one of the things that we learned in New York was that something like this that's waterproof is perhaps too heavy for a place that has walls and roofs. In Burundi we don't have that, so we need it to be waterproof so you can close it up at the end of every day. So we've started redesigning now with a designer based between in New Haven, a cardboard version. You can see one of the first iterations of that. We have a cardboard chair over there that the kids actually love building and drawing on. But it's light, recyclable, easily replaced, and in and of itself teaches users that they have an agency to design the space around them. And so we're trying to think through how something like that with a backpack of computers can reach new audiences and share information on water safety, on public health. We're working with the South African libraries to extend resources through something similar like that to legal resources. They don't have a centralized legal system. It's very confusing. And so most people don't really understand what's going on, so it's providing a space to actually learn about those resources. And I've always believed that libraries are everything. The mission is to respond quickly to what the needs are of the community. And through the history of libraries, we've provided toys for babies, we've provided all kinds of materials. Bookmobiles were defunded in the US decades ago. We don't have to innovate too much to recreate those. And to bring those back, I think it just needs to raise the awareness of the needs and how those resources can really make a difference in shaping the lives of and experiences of individuals, especially immigrants coming in, and folks from low-income communities that don't have access to that in their regular life, but also for society. Thank you.
Thank you. It's really exciting to hear all of the great things that your organization is doing all around the world. I'm just like really fascinated, and I'd love to hear more later. Joyce, you recently did a project where you created a human library, and I think a couple of panelists, we've heard this theme that we need people. It isn't just about having the technology, but it's about having the people to be able to share those stories, to provide the training, to help facilitate the skills. So Joyce, can you share a little bit about that human library project?
I was sitting here thinking, okay, to go from one extreme to the other, to go from tech to a different resource, which is a human. So the HumanLibrary.org is an organization that started in Denmark in the year 2000, and it came from a group of teenagers actually that were in a group, and one of their members was brutally killed by a hate crime. So they decided they needed to do something about myths and stereotypes and prejudices. So they started, it's a different organization, but this has turned into humanlibrary.org, and the purpose of it is for people to share and break stereotypes, really. So a person becomes a book. They volunteer to share their life story, which we've heard stories are important. So we had this at Criss Library in April during National Library Week, and we had 8 volunteer books. And we had a woman who was blind. We had a person that had bipolar depression and had electroshock therapy. We had a refugee from Nepal. We had a person that was deaf. And we really tried to reach out to the community to find those members of society that have stereotypes and prejudices that they fight, and that we're also willing to share. So how the library works, based off of the system of what a library does, is a reader comes in and checks out, not that kind of check out, a book. And you go and sit and have a one-on-one conversation. That person is a resource now. And you learn from each other. And what's interesting is the book learns just as much about themselves as the reader does. So how often do you get a chance to have a book come to life? And that's what happened here. So we had a great response, a great turnout, and we're looking for what you can do in your own communities. This costs very little. And really it was just a call for anyone that would like to share, and we had volunteers come, and you can do this in your community, and what a great way to start conversations. It doesn't have to be tremendously stereotypical, it doesn't have to be a horrible thing, it could be a farmer that has suffered maybe Parkinson's, that's willing to talk about that and share with others about it. So we are going to do that again in April, and hope to partner with Omaha Public Library and keep watching it grow. I should say that this organization is in 70 countries, so it's worldwide, and you can look it up, because you can Google it. But it is a great resource that every one of you has in your community. Thank you.
So we've heard about people resources, we've heard about technology resources, we've kind of gone across Nebraska to the globe, and we're still going to talk about the globe, but we're going to talk with Dr. Britigan more about her MOOC, which she mentioned had over 10,000 students last year, all over the world, 178 countries you mentioned. So what's next? I mean, that's a great success. So what's the next step for you, Dr. Britigan?
Thanks. Well, we're operating it again right now, and I was serious when I said it's not too late to start. We're in week 2 right now. So we leave our modules open. It's 8 weeks long, and when each module opens, we let it stay open so late joiners can catch up or whatever. People are as engaged as they want to be, and you can do it in your slippers, at home, and so it's kind of fun. The what's next is the fact that we consider this to be an interprofessional course. We encourage people to learn how to work as teams, because the dynamic in healthcare these days, in public health as well, is no person is an island and no provider can do it all. And so you have to learn to work together. And so one of the things that we promote in this course is communication. And I like what I'm hearing here, that storytelling is what comes out in the discussion forums, because everyone has experience. Everyone from childhood on up has had some interaction with a healthcare provider, whether it be when you got your shots and cried, or your dentist and you bit his finger, which I did as a child, evidently I'm told. I don't remember that. But everyone has something to share, be a good or bad experience, but who was it that said, I may not remember what you say, but I remember how you made me feel. And that's exactly what we're getting at in this course, is communication is very, very critical. And it can be life-saving at times because medication errors, just pulling one example out of the hat, medication errors cause a lot of problems in this country. Not only cause illnesses, but can cause fatalities too. And so getting across to someone the proper use of medicine is a huge deal. And I always reflect on my own parents who are in their 80s. And I was sharing with someone earlier that on Sundays, my dad gets out their pill boxes and they map out the pills for the week. For my mom and for my dad, he does both. And the issue is health literacy and the ability to understand about your health impacts everyone. Whether or not they know what that pill is for is another matter. Can they say the name of the pill? That's another matter. Are they taking it properly, timing-wise, amount-wise? It's a huge deal. To the point where if you reflect on the fact that if somebody tells you to take this pill 3 times a day, that means something different to each one of you in the room. And I challenge you about that because 3 times a day, I say to the healthcare providers that I explain this to, I say, do you use a 24-hour clock or a 12-hour clock? And they go, what do you mean? And I say, because do you have your patients waking up in the middle of the night to take that 1 dose? Or are you implying that you just intend for them to use waking hours to take these 3 doses? And they go, well, I didn't ever think about that. And I say, well, your patients are struggling with this unless you specify. And then guess what else? And I say how in my own family, and I'm sharing this with you all, and she would be chagrined, but my older sister, who is a very educated woman, and has hypertension, and she was supposed to take 1 pill in the morning and 1 pill in the night. And it was to maintain a steady state of this medication for her blood pressure. But she's a teacher, and she said she'd be exhausted at the end of the day, and she would take both pills in the morning. And so I was horrified when she told me that, and I said, have you told your doctor about this, And she said, well, actually, yes, I did happen to say something, and they changed my medication, so now I'm just on the kind that you just take once a day. She was not happy with me. So I walk the walk for my family, but the issues that I share are pretty commonplace, and it's nothing extreme, but it's happening every day. So communication and checking, we say, here's how I break it down. I say, when I mention the phrase health literacy, people don't really know what I'm talking about. But if I say to you, making understanding happen, what do you mean? Well, if I tell you to do something, I need to know whether or not you understood what I just said. And if I only use one-way communication, one direction, and I'm just telling you through an explanation, that's not checking back, is it? I'm not completing that loop. I don't know what you received. Communication takes place in the mind of the receiver. In the mind of the receiver. And so as a healthcare provider, unless I check back with you as to what you heard and what you're going to do, and maybe possibly ask you to demonstrate that to me, then I won't know, will I, if that message was clearly understood and that that person will use that information to improve their health. So the bottom line is, make understanding happen so that someone takes the information, applies it to improve their health. If they don't understand, they're not going to use the information, and their health will not improve. Thank you.
Thank you.
Soapbox.
I'm going to pose one more question to the panelists, and then I'll open it up for everybody else to ask some questions. Throughout the day, though, we talked about a lot of issues around broadening access to information, and I'm really interested personally on the creative side. So how do we come up with these solutions? How do we create partnerships with communities that are really going to be meaningful and relevant to make these happen? So I want to ask all the panelists, how do you see us creating more open dialogues about access to information and about collaborating with community partners? Because I think you're right, Dr. Britigan, it's a two-way street, even with communities, not just the patient-provider relationship, but us with communities, and really being able to be responsive and understand what are the needs and how do we fit in. So, who's going to be the first taker? All right, thank you, Rebecca.
I would just say that, I mean, we are all so busy, right? Everyone's super busy. We get caught up in our days, and in order for us to have really relevant conversations and for us to work together in a meaningful way, we have to be really intentional about it. Like, put it on your calendar. You know, I'm going to go out and visit so-and-so. Even if it's coffee or lunch, it's just informal. I can't tell you the stuff I've learned about the city just from having coffee with various people. It's just amazing. And even if you're so busy, I don't want to have to do that. I've never ever regretted just having coffee with a random person in my community. I've never regretted it. I've always learned something amazing. And the more that, so me as DoSpace executive director, the more that I know about what's going on in the city, the more I can brag on you, the more I can bring you into this project, the more I can help you in your mission and all of that. And so, you know, getting it on your calendar and saying, it is a priority to reach out and connect with people. You know, it's kind of just like a social thing to me, you know, because if you don't make that a priority, it never will be. You're going to get caught up 6 months later, you don't have any community connections because you were too busy doing whatever it is you do. So I really feel like, you know, prioritizing the social connections is really, I mean, that's where I started in my position. It's just really helped out a lot, so.
Can I go next? Because then I can get it over. I would say too, that sometimes we have to face our fears. Often we have to face our fears, and it's easy to be fearful of meeting new people and doing new things. So don't be afraid, and don't be afraid to fail. That's another lesson learned. So just go make that first connection. And don't get frustrated when it doesn't work the first time or the second. Small steps. And you've probably heard the story of the starfishes up on the beach. And the child throwing it back, and somebody says, why are you doing that? They're all going to die anyway. Look at it, and the child says, made a difference to that one. So make a difference to one, and then it can grow.
So I think everyone being here is a huge networking step. And I've already heard many things that have excited me about some possibilities for our center. You guys need to talk about, Athena has actually 2 of our pilot projects involving, one's migrant worker health, that she had some fabulous results about depression and understanding some of the challenges in our migrant community. I think a nice idea about she also has an immigrant worker in the large facilities in Missouri, a project down there with Criss, so we're very excited about that. So networking and reaching out to all these different groups. I'm working with some cowboys in Kansas. You know, we're talking about feedlots, and so we're getting some great information from them. So just trying to reach out. I will give you this. We do offer through the center $20,000 innovation emerging issue grants that we would love to see the community put in for. We have more information talking about that. But that is how we fund some of these wonderful ideas, and some of them pan out great, some of them, you know, that people struggle with, but that's research, and we understand that. So I would just leave you with that thought too, of a great way to get your idea into action, as long as it has to be better.
And I will briefly say, I wasn't just being silly about hopping in my car. There's a method to my madness because last week I was announced at UNMC to be the new director of the Office of Community Engagement. And so along with my public health teaching and research, I will be talking with community like you and seeing how can the Med Center work together with community. And we're actually in the process of creating a database. And so all of you represent some function in the community, some entity, probably more than one hat. We all wear multiple hats, and so visit with me about what those are so that we can put them in our database so that when people say, how can I connect with community on this, you can say, oh, let's pull that up and we'll offer that. And so we're trying to be a gateway and a bridge from the Med Center to the community and back and forth, so that when you need somebody at the Med Center, we can put you in touch with them, and when the Med Center needs community, we can put them in touch with you. And so it's a back and forth loop, two ways.
This is great. I absolutely agree that for our successes, a lot of it was built on, staying spontaneous, saying hello to everyone, generating new ideas. I would just add, though, that I think one of the most important things for us has been to remember to take a step back and think about our work internally, critically and consistently, and think, I think one of the biggest problems of the incentive structure of international development, and I think this is true for domestic, especially nonprofit work, is that there is no incentive to stop working except for your own moral standing, right? If a program has succeeded, you should close as an organization. And I think our goal that I always say to myself is, at some point, I want to close our organization because that work will no longer be needed. And to really always take a step back and think, I didn't get into this for money, I didn't get into this for XYZ reasons that, I would be working in the corporate sector if not. Why am I actually doing this? And am I actually fulfilling my mission? I think that is absolutely the most important thing that we can do, because if we all do that on an individual level, I think we would also compete less against potential collaborators, and also really, really be specific about what mission we can actually solve.
Thank you. Are there questions in the audience?
So, I'm Holly. I actually work for the state of Nebraska. I work at the Office of Early Childhood, and recently, you guys have heard about it, step up the quality, where we care about the quality of care our little ones are receiving, and we really value it. I guess I was going to ask you about farmers. It's been kind of a challenge for us to take our in Omaha lives out into Nebraska. And when I say rural Nebraska, I mean further than Kearney.
Yeah, Kearney is, that's not for
right. That's not
a big city.
And I guess the challenge that I know we're going to be coming up against is when we are in the parent education piece and going to parents and trying to help educate them on being parents without saying you're a bad parent, because that's not it. And so I didn't know how you were approaching the farmers and saying, I know you've been doing this for decades, let me show you a better way.
Yeah, absolutely. We have a huge problem with that, a huge problem, because who am I? The first thing I tell them is I spent over 20 years as a hog farmer, so I know hell. And it really does give me some grievance with them. And just like you're going to go in, you're going to say, and I don't know if you have children, but if you're going to say, I've worked with children, right now the say you're doing it wrong. I said, can you show me how you would do this? Or what are you using? I said, what are you using when you go into a ring to protect your lungs? Nothing. Oh, well, let me show you some options here that we really think. Or we talk about the barriers. There's a lot of barriers with these guys. Of course there's a lot of barriers. We're asking them to put on something that is going to make them hot and uncomfortable. But I do want them to understand that it's going to say, and they'll tell me, well, I already have, 50% of my lungs are consolidated. I said, well, how about that other 50%? Let's go back to one, my golly. Or they're all 75% deaf. Well, how about that 25%? If any of you know farmers, tell me. I mean, every farmer I know, my husband has lost 75% of his hearing because we were block farmers. I've lost a good percentage of it because I didn't spend as much time with them. I spent enough of those human costs. So we have some things, some commonalities that we can discuss. When I went up to North Dakota, we were talking about, we had one of my son's school friends killed on a country road by a farm truck. And so I can say, I understand what you're saying. I know that trucks are traveling too fast and they don't see us as civilians. They're trying to get their jobs done. We're all just trying to get home, right? Everybody's trying to get home. So when you approach folks, my recommendation would be to also focus on your health departments and places where kids get to get, or your rural pediatricians or these docs who see them and are already trusted by them, and you are introduced to them as, we've got someone here who's going to assist as you do that. And so the communication with these trusted professionals, I think, is going to be a huge.
Actually, you can make storytelling come into play also because there's a series of early childhood milestone development books through the CDC that are downloadable. You can look at somebody if they're amazingly mind-free. And what it is a local pediatrician wrote it and a local woman illustrated it, and then it got printed and distributed free, and now it's PDF you can download too. And it's about a little kangaroo, Joey, guy, similar to your drowning story with your otter. I mean, it's very powerful to use with kids. And as the parent reads this book, picture book, there's a little star at the bottom of each page, which is a little question for the parents about Joey, the little kangaroo, is doing these things. And at the bottom, it clues the parent into, 3-year-olds should be wanting to do this or should have this. And what it really is a way for parents to detect autism very early, the spectrum. And so if your child's not making eye contact early, if your child's not wanting to get your attention by saying, watch me, which is really difficult, watch me, Mom, if they're not doing some of these things, there's a list in the back, checklist, and if your child's not doing some of these things, maybe have a conversation with your healthcare provider, because when the parent is with the child a lot, more than your annual visit with your pediatrician, you can pick up on some things, and they're actually working with daycare providers and preschool teachers to complete the triangle between the parent, the teacher, and the pediatrician to reinforce that fact that whoever is with this child 8 hours, and that could be daycare and preschool, maybe even 9 hours or more, when they can observe this child and they see a range of 3-year-olds and how they are normal behavior, the issue is if it's the parent's first child, they really have no frame of reference. And they don't know what really to expect unless they are put in very well by their pediatrician as to what is normal developmental milestones. And so through storybooks and including parents in to be part of the team, again, part of the team, then watch for resources like that.
It's interesting to go back to the basics of that. We started a record this summer, and for people to use programs to participate, you apply on a computer in a program, and a lot of people in childcare don't have people. They don't have access to these IK boxes or something like
appreciate you all being here. You all share a very unique perspective. And I think one thing that we can figure out is that solutions can come from all different fields, all different industries. And even though we might be working in public health, some of the things that are working in public health may be relevant for you working in business or working in education or working in any other field. So what I hope that you gathered out of this panel is that there's lots of solutions. Use the information that's out there from the different collaborators that you have and really think about what is possible, because there is so much out there that we can do and we can do together.
Save a little time for you guys. I kind of wanted to put in my own 2 cents about the last question you asked the panel about creativity. And this isn't just a plug for a creativity library, and it can be a resource for you as well. I am a very right-brain thinker. I also am a very resourceful person. I have worked in nonprofits for a while, and as many of you know, there is not money a-flowing for all the big ideas you have. So what I would like to suggest is really about creativity. And some people think that because they're not an artist, they don't have creativity. You are absolutely wrong. Everybody's creative in all kinds of ways. The best way to utilize that is to find other people, like we've talked about all day, but really think about a different kind of way to approach people. I've seen so many people who work, whether it's in business or health or the arts or whatever it is, say like, well, this is how we always do these arts things, or this is how we always do these business things, but we're hitting a wall. Well, maybe you should talk to someone who has nothing to do with what you do and see what they're doing, what's working for them. Because there are things that are very artsy and very conceptual and weird that might just be the right thing for your, Fortune 500 company. You don't know. So ask. I also, when I was putting this together, I was really thinking about what do people all over the state are dealing with? Do they know who to talk to? Are there things they haven't thought of before? Because that's, I think, the big question for me. And it can go as big as like, I need to understand what my legal needs are, my health needs, and these are this very tangible things. But then there's also things like when I brought in, the documentation preservation group, because I know that there are people in communities who are like the historians for their towns. They have all the photos, all the articles, and they're in boxes that are deteriorating. How do you make that available to the people in your community? How do you keep it safe? Could you make a book out of it? Where's Tip? Could you bind it into a book? Could you work with a college library like what Amy does in the archives to have them help you protect that stuff? Can you scan it and put it online? Can you hire someone like Lisa who can just help you put them into folders on your computer? I mean, I know all of us have that problem, trust me. So, my big push, of course, is about being creative and find people to do things that are not their intended use. That's a health term, right? Intended use of prescriptions. So find people that you know there's something in there that can help you, even though they don't think they can do that. There are a lot of people like that. So sorry, that's my soapbox.
Hello. Okay, sorry. I just wanted to quickly say, so in the previous panel there was a question about well, how do you find public programs, social programs, that kind of stuff. There are apps, there's an app for that. And check it out on Bertha.com. It's just one example of an app that scrapes other websites for information on that, so it's all accumulated in one spot. But what I wanted to let you know is that we're launching a Slack community. Slack is an online forum. It's going to be used for use-based staff, volunteers, and everyone in the world who wants to join. So if you have a question about technology, post it in there. If you're wondering, is there a tech solution to this? Is there an app that might do this one thing that's boggling your mind? You need an invite. Just go to our website, usespace.org, and just shoot us an email with your email address. And I'm looking to kind of build that out so you have your own IT service. We've already got a bunch of techies on there ready to help. So
can you repeat
website, USpace?
DoSpace.org. Do as in the verb do.
Got it.
And then space.org.
Right.
Yeah.
And contact info for all of our conversationalists and panelists are on the event page on our website.
On our website, you can find email addresses, websites, Twitter handles, Instagram accounts, LinkedIn accounts, all kinds of good things. Facebook too, that's there too. So please keep in touch with the people you've met today, because that's how we do it. All right, let's call that a day. I hope that you find